right, good morning everybody. I'm super excited to be here. First off, for those that don't know me or haven't been in any kind of class with me, it's very weird. I said this at the Kaya conference, it's very weird to have my back to the mirror. Especially in this room, I'm always here, like shaking the booty in this direction. So to face you guys is pretty amazing. So my name is Gabriel. I'm a family nurse practitioner that specializes in hormone replacement therapy. Previously, I worked in metabolic oncology, which I still love. I love working with cancer patients and trying to get them healthy and back into remission. But after a few years of that, I was a little tired of it, and I wanted to go into something else. And since hormones are really tied close into metabolic oncology, I deep dove into hormones. When I went through menopause myself, I tried really hard to fix my own hormones, get my health back, and that really showed me how deficient we are with women's health and hormones. And then I opened up my own private practice, and now that's what I do. Is I have a telemedicine practice that specializes in functional and integrative medicine, and I work with women and men with hormone replacement. And so that's what I want to talk about a little bit today. It's going to be maybe about 20 to 25 minutes. I will take questions at the end. I know there's a 9:45 class that some of you guys are headed to, but I will stay a little bit after if there are questions. I do have flyers and I have cards up here, should you want more information about it. But the first thing I want to start with is, if you're here and if you saw that I was doing a hormone talk, the one thing that I want to validate for you is, I hear you. Changes happen. It happens slowly, and then all of a sudden you're like, why do I feel different? I don't know what's happening, but something is changing. Whether you're in your 30s, 40s, 50s, 60s, 70s, it's insidious. It creeps up on you, and then you're like, I'm tired. I used to be able to do this. I used to be able to lift heavier. I used to sleep well. There's like so many things that you just like fantasize about, and you're like, the youth is wasted on the young. They have no idea like how good they have it, And then you get older every single day, and you're like, man, I want to do all these things, but I just feel like something's different. I'm here to validate that that's true. Hormones absolutely matter. Hormones are they're communicators. They're communicating certain organ systems in our body. They're communicating for muscle synthesis. They're communicating for bone density, brain health, cardiovascular health. And slowly, day after day, birthday after birthday, it just changes. You can't quite figure it out, but something is different. And you know what? Most everybody here, all Kaya girls, and I've been a Kaya girl since 2012. Guys are strong. Your minds are strong. You guys show up every single day. It doesn't matter how tired you are. It doesn't matter what time it is in the morning. Like you 5 o'clock people, I don't think I've ever met you. I call them unicorns because I've never been to a 5 a.m. class. I don't know who these people are. Oh, I know unicorns back there. It blows my mind. You guys are very strong-minded, and you guys push through these changes. And as we get older, you close your eyes. You don't know your age. You could wake up and you feel like you're in your 20s, but you open your eyes and you're like, wait a minute. But inside you feel like it. So your mind is strong in the sense that you get up, you show up for these workouts, and every day just gets a little bit harder. And I'm here to tell you that can be normal, and if that's something that you're willing to work through, that's totally fine. But there are other options. And the first thing I want to talk about is lifestyle. So the fact that you guys are Kaya girls here tells me you're already working on that. And so one of the most important things that my patients have to work on, and some people come to me without having this even in place, and those are lifestyle changes. It's fuel, train, and recover. And that's what I think Kaya embodies. You're gonna fuel your body with the best foods possible. You want whole foods, unprocessed. You're gonna train. You're gonna train here at Kaya in different ways. And what training does, and this is super important, like when you're lifting weights, whether you know this or not, if you're lifting weights and you're doing a little bit heavier than you normally would, you're actually signaling that your body needs more testosterone. So wherever in your body that's working on testosterone, the brain goes, oh, We need to up our testosterone. When you are in a class that does cardio, what you're doing is you're decreasing your insulin sensitivity. So whatever blood glucose is happening in your body, you're bringing those hemoglobin A1Cs down, you're bringing glucose levels down, you're being more sensitive to insulin, which is super important. And when you're in like a yoga or a flow class, you're teaching your body to go into a parasympathetic, you're lowering cortisol. So whether you realize this or not, just by showing up, you're doing a different version of hormone replacement, okay? So don't just always do straight cardio. Guilty. I'm very guilty of that. You have to lift. I've been lifting recently though. You have to learn to relax because all these hormones matter. And so when you show up, it's more than just, oh, I need to work out. There's a physiological chemical reaction that happens in your body that is beneficial when it comes to hormones. So the very first thing that I want to say is just by showing up, that's hormone replacement. It's a tiny bit of hormone replacement. You're signaling to your body that, hey, I want to build muscle. Now, that's the next thing that I wanted to talk about is there's different ways of what hormone replacement looks like. And what you're doing is fantastic. You're showing up and you're doing that version. But hormone replacement looks different for every single person. Each and every one of you has a different lab profile. When I draw labs on someone, and I'm not gonna dime you guys out, but I have a lot of patients here in this room right now. I send out a lot of questionnaires. So if you check your email and you're like, oh God, Liz is asking me a questionnaire again, because I'm monitoring. I want to know like what's happening with your symptoms. Like, are you sleeping better? Is the brain fog lifting? Are you able to build muscle? Is the weight starting to come off by doing the exact same things that you're doing? So there's questions in there that I'm monitoring, and my system has like this charting, tracking method where I can see, is something worsening, is something lowering, is it getting better? Because the whole goal is to be able to optimize your hormones. And that is something that you don't realize what you lost until it comes back. And then all of a sudden you're like, wait a minute, I'm not used to waking up with energy. I'm not used to going to a workout and just being like, yes, did that, burpee, nailed it, or you're just like, oh, this is so hard. Trust me, I don't like burpees, but I can do them, and I'm pretty proud of it when I can do them and feel really good after, and I'm not like trying to catch my breath and dying, but that's the capacity that every single one of you has, that feeling of, I'm gonna just say 30s, because I thought I felt really great in my 30s. In my 30s, I was actually deployed to Afghanistan, and I felt like I was beast mode. I was carrying 70 pounds of gear. I was going out on mission with guys that were like 6 foot, and I was like, I am beast mode. I feel better now in my 50s than I did in my 30s. So I'm like, send me again, give me the gear, let's go. That's because I'm like, it's crazy to me, but I do. I feel better now in my 50s than I did back in my 30s. And that is really important for people to understand that it doesn't matter how old you are. It doesn't matter how you feel right now. There is that capacity to actually feel better. So what I brought with me today is I wanted to show you. So if you're younger and going through perimenopause, or if you've already gone through menopause and you're just like, I don't know, I'm fine. I want to show you what hormone replacement can look like. You already know what the lifestyle looks like, right? You're working out, coming to Kaya. The eggs are here for a reason. Someone asked, I have chickens at home, so I bring eggs to give someone. But lifestyle, your food, making sure that you're fueling your body in a way that is super helpful. But these are supplements. So some people are like, what? I don't like prescriptions, and I agree with you. My whole job with integrative medicine, and I also do concierge medicine, is I try to get people off of medications. So I try to get people to minimize what they're on, because that's what we do in Western medicine, is you just dole out prescriptions. These are just supplements. So when I draw labs on people, and they're just like, yeah, I don't really know if I really want to do hormone replacement or not, there's supplements. There's ways to be able to metabolize your estrogen out of your body if you're estrogen dominant. That's what DIM is. I've got boron. I put people on boron all the time, and that's to help to increase your free testosterone levels. So if you're in the gym, like lifting heavy, boron is really, really great to have your sex hormone binding globulin release testosterone so you can actually use it and build muscle. Boron's also really great for the bones, and bone density matters. When you get postmenopausal and your estrogen levels drop, you really need a fundamental structure for your bones, and so boron's great for that. So sometimes that's what supplements look like. DHEA. DHEA is a precursor to cortisol and testosterone. So, you don't necessarily need to be on prescriptions. There can be supplements, or there's a combination. I brought this one because part of hormones, which no one really talks about, is thyroid. I can fix your female hormones, but if your thyroid is not great, that's hard. If you've got a primary care doctor and they're watching your thyroid labs, they wait until your TSH is over 10. That's your brain yelling, I need more thyroid hormone, So as that TSH elevates, that's your brain saying, uh-oh, the thyroid's not doing its job. That's where iodine comes in. You can get iodine through your diet. Like, always do through your diet first. Then there's supplementation. There's pills, and then this is my husband's iodine. I stole it out of his cabinet this morning. He drops this in water and then drinks it. I think it tastes terrible. I don't recommend. But there's pills that you could take for iodine.
Can you also put that on your skin, Liz?
You can put it on your skin, yeah,
and
it can absorb it.
That's what I do.
It oxidizes. But this is a higher percentage of iodine that you can put in your water. You can put it on your skin. You can take it as a pill. But thyroid matters, and so when I draw labs for hormones, I'm looking at thyroid too. And I treat subclinical hypothyroidism, which basically means if you're between 2 and 10, I will treat you. Whereas Western medicine waits until you're 10, and then they're like, okay, now clinically you have a thyroid problem. But for years, you can be subclinically hypothyroid for 5 years. And you're slowly gaining weight, your hair's falling out, you're tired, your skin is dry. I treat that. That's why I work in integrative medicine. I don't go through insurance. Everything is a cash pay for appointments, but I can order labs through insurance and I can do prescriptions through insurance. So that's why I can go outside of the lines. And for those of you who've seen my business card, which I have a bunch here, my title is Chief Renegade. Because that's how I feel, that's how I do medicine. And my tagline is Dare to Be Well. And that is because in modern day, it's hard to be well if you follow just regular standard of care. You have to take full control of yourself and how you feel and put that in your hands, and you need to have a provider that's willing to listen to you and really react and say, okay, I'm feeling different, let's figure this out. And that's where hormone replacement really comes in. Now this last row that I have here is hormone replacement. These are all mine, by the way. So these are all stolen out of my cabinet. So the first is, and sometimes I can combine these, okay? And so this is one type of estrogen, okay? So this is estrogen cream. There's estradiol in here. Sometimes it's E1 and E2. Sometimes cream is a preference, and then sometimes there's a patch. So it just depends on, what your goals are, how often you want to be able to deal with things. This is a twice-a-week patch. There's a once-a-week patch. This is usually a daily. It just depends on, what your estrogen levels are, what your lifestyle is. I used to do the cream, but now I do a patch because there's just less things to remember. This is my favorite right here. So anyone that has one of these in their cabinet, they know exactly what this is. This is testosterone cream. Oh, if there was a fire and I can only grab one thing, this is what I grab. I'm telling you. This is the one that I absolutely love, and this is the one that your OBGYN will never prescribe. They'll be like, oh, we don't do that, you need to go to someone else. Well, guess who the someone else is? It's this one right here. Okay, so this is testosterone cream. Now, you can combine it. Some of you might be on like this all-in-one cream where it's all in one, you don't have to worry about anything, you just put cream on every day. But I like everything separate because my life is sometimes very easy. and sometimes not very easy. And I like to be able to adjust it according to what's going on. So if I'm on vacation, or if I've got a crazy talk that I have to do, you know, sometimes I'm gonna adjust my hormones just a little bit so that I'm feeling optimized to be able to do those types of things. And so this testosterone cream, you know, normally I do 2 clicks of this, and on some days, I call it the extra click. Any of my patients in here know. I call it the extra click day. You're like, oh, this is gonna be like a really tough workout. Oh, I have to talk in front of a group of people. Testosterone gives you confidence. Testosterone helps you to build muscle. Testosterone is super important for women. And as our levels drop during perimenopause, it's almost like you forget what that is like.
I was just wondering if anyone's connected to Ox.
Oh, my big show.
Is what?
So that's testosterone. Actually, I didn't go over this, but estrogen is really good for your heart health. It's good for your bone density. It's good to make sure that you're thinking clearly. If your estrogen level is way too low, you're gonna have a hard time sleeping. There's a lot of really good, but estrogen, even though I wouldn't grab this one in a fire, it's the only reason I wouldn't is just because you don't feel it. People don't feel their estrogen levels unless you're overdosed or underdosed. But when you're in that happy space, you don't necessarily feel it. So some people are like, oh, I can feel it. Like my testosterone, I can feel it. But you don't feel your bone density. You know, you might feel a little bit of like brain fog, but you don't really feel like, oh, you know, that when you put your estrogen cream on, that there's like this huge difference in it. It builds up over time, and then you get to a place where your bone density's improving, but you don't feel it. So that's why sometimes this one is very overlooked. Testosterone will always win because you're just like, yes, that's the one that gets you up, out, doing all these crazy things. I've overdosed myself on testosterone, and I loved it. I loved every second of it. I was like, this is why men are the way that they are. I mean, it explains so. I understand my husband so much better now. I used to think it was his personality, but it's hormones. Hormones are fundamentally part of like who we are. And so if over the years you're just like, you know what, I don't want to do new things, or I don't feel like going on this crazy hike that I've never been on before. Like, what do you mean mountain biking? I'm 50. I'm not gonna mountain bike. You know, that's testosterone, man. You put testosterone on and you're at a good optimized level. You're like, yes, let's go. Let's go camping. Let's do all these fun things. You know, it's an amazing feeling that you notice. And when you don't do your testosterone, you might just be like, I'll just stay home today. I'll read a book. It's all good, you know? That's why when men get older, they kind of go into that like beast mode, and then they kind of go slowly downhill as their testosterone, because they don't really go through, there is an andropause, but they slowly lose testosterone, and then they're kind of in the, this year, which I kind of like, you know, I kind of like them not arguing, this year, fine, whatever. But, you know, it explains a lot when it comes to hormones. This last one that I wanted to show you, this is just the only one that I'll prescribe orally, only one, because I will never prescribe an oral estrogen, is progesterone. Progesterone also comes in a cream. I didn't have one to show you, but progesterone comes in a cream, and progesterone comes in a pill. If anyone's having sleep issues, I usually prescribe the pill because as it metabolizes into allopregnanolone, it helps you to sleep, and it helps you to sleep deeply. Some people sleep so hard that they feel really groggy in the morning, and that's kind of a weird feeling. So if anyone that's ever tried progesterone and all of a sudden you're like, whoa, super groggy, it does get better. Sometimes we'll have to adjust the timing of it, but progesterone, actually all of these also come in injectable. And I don't know if you guys knew that, but you know, women can actually do subcutaneous injectable, and so I do have some patients that are on injectable. It just depends what's right for you. So that's what hormone replacement can look like. It can look like nothing. It can look like a little bit of supplements, a little bit of prescription. It can look like all prescription. It could be prescription, the supplements, and the lifestyle. Because what's important is it's not either or, it's both. Your lifestyle has to be in place in order for your hormones to be optimized in a way that is going to make you feel amazing. And now there's different goals, okay? So the last thing that I wanted to cover about hormones is there's different goals. Some women just cruise through perimenopause, they get to menopause and you're like, I'm fine. I don't have hot flashes. I don't have issues. I'm not sure what this hormone replacement is about. I'm totally fine. This is a natural thing. I'm just gonna embrace it. So if the goal is to be as natural as possible, then hormone replacement might not be for you. If there's a second goal is, I'm not feeling great, something is different, I am having hot flashes, I have brain fog, I'm picking up a little bit of weight, but I just want to be on the minimal amount of hormones so I don't experience those things. That's the mentality of Western medicine. If you go to an OBGYN and you're like, whew, 47 and I'm having some hot flashes and I'm not sleeping and my brain's feeling weird, they'll prescribe you something. It might not be bioidentical to what your body is used to, but they'll prescribe you the minimum amount of hormones in order for the minimum amount of time, just to get you through that phase. That's what standard of care is. So if you're on hormones, let's say you went to your OBGYN and you're like, I have a patch, like my GYN give me a patch, but do they check your blood work? Are they moving you up in levels, or are they just giving you just the minimum so that you don't have those symptoms? That could be a goal, and that's totally fine too. The third goal that women will have is, I want it optimized. I want to feel amazing. I want my hormones to feel like I did when I was 30, because guess what? We lose our libido, right? We're just not interested. That can be completely normal. We can't build muscle. You don't feel strong. You wake up tired. You have the brain fog. All of the things that just slowly come on over the years, all of those can slowly reverse with hormone replacement. And so as we bring you to a level, check your blood work, ask all the questions. Like I said, my EMR will automatically send you questionnaires about every 4 to 6 weeks. And whether we have appointments or not, I'm watching it. I'm watching to see, are you trending better or are you trending worse? Do I need to make a prescription dosing change? Do we need to order lab work? Like, what's happening with this person? Because we're trying to individualize it specifically to you. So when you tell me that this is what's going on with you, or this is happening, like, to me, it's like this mystery. I have to figure this out. And you're like, well, what do you mean you're having headaches? Well, what do you mean your sleep is worse? So the chemistry and the physiology is in my head trying to figure out, like, okay, what else is going on? I have a really thorough medical history. I need to make sure that the hormone replacement is safe for you, and I want to make sure that we're not increasing risk. But I will say, I do hormone replacement on high-risk people. You gotta remember, my background is in metabolic oncology, so if you have some sort of weird history, you're not an automatic no. I'll say, okay, there's a risk, and if that freaks you out, that's okay, because I'm not here to push anything on you. I'm here to give you information so that you can decide, is this right for you, or is it not? And whatever your answer is, it's fine, because like I said, I'm not here to push anything. I'm here to be your partner to say, hey, this is what's going on, and this is how we can optimize it. So I do hormone replacement on high-risk people, just so that you know. So if you feel like, oh, I'm not a candidate because of this, yes and no. I just like to make sure that you're educated in there is a higher risk, but there are other ways that we could do this. And that's why I brought this to show you. If you're at Kaya, you already got one level of it there. There's supplements, there's different ways to improve your hormones without necessarily making it so risky that it freaks you out. But you're looking at quality of life, and then you're also looking at, okay, I have this history of whatever that is. We just have to figure out and balance it and do what's right for you. And whatever that looks like, I'm always happy to support. So I'm at the point of my talk where I'm going to start taking questions, because I want to be able to take questions before your guys' 9:45 class. I will stay after 9:45, so if you have something that you want to ask that you don't want to ask in front of like the whole group, I will be here a little bit afterwards when everybody else goes to that spin class. So I have a question right here. What's your question?
Okay, so the nurses study that came out that I know has been debunked.
Yep.
I don't think that's general knowledge, so can you give us a little bit of insight on that? And since I've got the cue, how about all of us who stopped taking hormones and we haven't taken them for 15 or 20 years, can we start again?
Okay, so 2 parts. Kaya Conference, I actually did a whole presentation on the Women's Health Initiative that came out in 2002. Women's Health Initiative had such huge media coverage on it. It scared the crap out of everybody. Like my mom was on hormone replacement, and that came out, and then it was like, you're gonna die, you're risk of clots and heart disease and breast cancer. And I think there's been a fear of it ever since. So from 2002, when the Women's Health Initiative came out, up until November of 2025, okay? Women have been freaked out. There's been a black box warning on hormones because of that study, which has now been debunked. And how the heck did they debunk that study? They debunked it by doing a retrospective study on over 2 million Medicare patients. And so this is looking at the sample was huge, okay? We're talking over 2 million, and they looked at outcomes of hormone replacement versus not hormone replacement. So that's how they debunked the Women's Health Initiative back from 2002. And now they're saying, oh, oopsie, we were wrong. So if you were tortured between 2002 until last year, I am sorry, they definitely got that one wrong. You know, hormones are not what we thought, the danger that we thought. You have to understand there's a difference between synthetic and molecularly identical. And my talk from the Kaya conference, I mean, who's there? Was anyone at the Kaya conference?
Yes.
Okay, so my slides, I mean, I put chemistry up there and everything. I showed you exactly the difference between these molecules. And what they were looking at is they were looking at, you know, the outcomes for synthetics. Because you got to remember, the pharmaceutical industry, they care more about money than they care about you. And the only way that they can patent something is if it's different and it's not identical. So they have to change something in order to do that. Now, for your second question is I stopped hormones, and then can I restart it? Generally, yeah. I've started hormones on like 80-year-old women that either were on it or have never been on it. We just do it low and slow. We start slow and slow in order to do that. Now, standard of care will say, oh, if you've been not on hormones for more than 10 years, it's just not worth it for you. The outcomes aren't great. I don't agree with that. I think hormones are natural to our body, and that if we do it, if you haven't had hormones for a long time, it does freak your body out. All of a sudden you're like, what is this? Like what's happening? Like all of a sudden you have this exogenous, meaning coming from outside of your body, you know, progesterone, testosterone, estradiol coming in, and your body has to remember, you know, where to dock it on the receptor, you know, what signaling it has to trigger. So it's completely fine to start as long as, like I said, there's a thorough history. I run labs, and then we start low and slow so that your body can get used to it. And then depending on your goals, do you just want to minimize something or do you want to optimize? Then we kind of push it as far as we can. I've actually started hormone therapy on women that are have osteoporosis and have had fractures. That's scary. If you've got osteoporosis in your family and there's fractures possibly in your future, you definitely want to get your estrogen levels, you know, to an optimized level. And so when you're thinking about optimizing these hormones, there's a lot inside of your body that you can't feel. Like you can't feel, you know, let's say the onset of dementia coming on, cardiovascular disease. You can't necessarily feel your bone density changing. So the ability to treat the deficiencies that are happening in your body, I think, is available to people of all ages. The sooner you start in perimenopause, the better your outcomes, but you can absolutely start it later. Does that answer your question? Okay, so there's another question over here.
And is it beneficial starting later?
It can, absolutely. It depends on how you feel. It can help with bone density. So let's say we're concerned about bone density. If you start some sort of estrogen, and everything is going to be paired. We don't do hormones by itself. It's like a group. So if you're doing estrogen and you're doing osteogenic loading, which would be things at Kaya, it would be weight resistance, it would be jumping, it would be something as simple as just heel drops. Just doing something like that can actually help your bone density. I mean, how easy is that, right? Get on some estrogen and just stand in your kitchen and make big noise. I do it in my bathroom. My husband's like, "What was that?" And there's been earthquakes recently. I'm like, "It's just me and my heel drops, man." You know, I mean. Heel drops are super easy to do. So it is beneficial to start even if it's later. And what I think is important is I get baseline labs, and then you can actually watch. You can watch not only your levels of hormones increase, I draw labs on what your brain thinks of your hormones. Because the brain is going to continuously yell. It's going to be like, "Come on, ovaries, what's happening?" You know, and the ovaries are like, "We're out, man. You know, there's nothing left. You know, what do you want me to do?" Or let's say you had a hysterectomy. The brain doesn't know that. The brain's still yelling at your ovaries are not even in there anymore. You know, and so I watch all those labs. And when your brain tends to be happier, you're going to feel good. because the brain is the foreman of everything out there. And so all these labs are telling me this picture of what's going on with your health. And then I'm asking you, I'm saying, how are you feeling? You know, are you at beast mode when you come to Kaya? You know, are you sleeping well? You know, it takes a while. I was saying, on average, it might take about a year. So it's not something that's magical that happens overnight. It takes prescription changes, it takes looking at labs, we slowly adjust things, you know, higher, lower, add supplements, take away supplements, whatever that is. In addition to labs, I'm also a Dutch provider. So anyone that knows what the Dutch test is, I can actually order that. I order it, I don't do it often because it's very, very expensive. Some people need it, but I usually can figure things out just off of labs. Most of the time I can run it through your insurance. Every once in a while you might have to cash pay a lab. That usually runs about $75. That's just because insurance gets mad. You know, if I keep running your labs every 3 months, they're like, what is happening here? You know, so at a certain point I'll be like, okay, we need to see these labs, but let's do a cash pay lab just because your insurance is gonna get really pissed off at me. And my goal is not to do that because they already don't like me because I don't participate necessarily with them. But it is something that I think is really important. What other questions?
On the flip side of that, you talk about starting early in perimenopause.
Yeah, okay, so when I was at the Kaya conference, I talked about the 3 Ps, okay, and these are our bumps in life. The 3 Ps are gonna be puberty, right? You all remember that. That's pretty terrible. That's when all the hormones are doing crazy things, your body's doing crazy things. That's the first one, puberty. Second one, pregnancy. Hormones are doing crazy things, your body's doing crazy things, and you know, but it's short, it takes a while to recover from pregnancy. But the third P, which is same category, perimenopause. So for those of us in the room that either been through it or are in it, it's terrible. It is so terrible. It's the same thing. Your hormones are doing crazy things, your body is doing crazy things, and it could be for a long time. Some women just flow right through. You're like, oh, 2 to 4 years, good to go. I have women that have been in perimenopause for like over 10 years. Sometimes going into 15, it's torture. You know, I just had a woman that's 58 and she's still having a period.
Oh, wow.
What? I mean, it's not regular, but she does not qualify for menopause because she's still having a period. So perimenopause is terrible. And you don't have to wait. I mean, it is harder to optimize hormones because what's happening is I can give hormones, but then, you know, it's the ovary. If you still have your ovaries, the ovary's like, I'm gonna work today. Then all of a sudden you have hormones, and then now you're overdosed on hormones. And you're like, I'm emotional. I'm fighting people. Like, and then all of a sudden you're fine. And I'm like, that wasn't me. No, that wasn't this. That was your random ovary doing something crazy over there. So as long as you understand that perimenopause can be pretty chaotic, but it is important to start because I like to look at women when they're still having a cycle. I'll draw labs on them on day 21, and I want to see what that looks like because as it changes and as these hormones decrease, we can actually replenish it. And then when you hit menopause, it's like smooth sailing. You still got your muscle. You're still sleeping at night. You know, you don't have any brain fog. You're maintaining bone density. Let me tell you something crazy about bone density. When you hit menopause, okay, so for those of you in the room, like I know exactly when I hit menopause. I was actually with the menopause young. When you hit menopause, they will wait 5 years before you get a DEXA scan. Okay? Yeah, that's the standard of care. 5 years. You hit menopause, you're like, so they would, my care goes through the VA, so they would not order a DEXA scan on me because I wasn't in menopause for 5 years. Once I hit 5 years, they're like, okay, we'll hit it. And that is because you lose most of your bone density in the first 5 years after menopause. Okay? And then guess what? You get a DEXA scan and all of a sudden they're like, oh, we're so shocked. You have osteopenia now, like. But you know what? We've got this prescription here, and you know you could do this, and there we go. We fixed it. Here, you know, here's your medication for your osteopenia. Perimenopause is the time where you know we don't want you to lose bone density. Bone density will slowly, you know, decrease if you are not doing any kind of osteogenic loading. But if we replace hormones early enough and we adjust, you know, so perimenopause, you know, appointments are usually every 3 to 4 months. and I'm checking to be like, okay, how are you feeling? Do you need adjustment here? I might order labs every 6 months because, you know, it can be crazy. We're keeping track of your periods. I have graphs in my EMR that have all these like crazy things in here because I'm watching weight. I'm watching testosterone levels, progesterone levels, DHEA levels, LH, FSH, all these labs I'm monitoring because you have to. You absolutely have to monitor these labs to know what's going on. And then at a certain point, the periods slowly disappear, and then guess what? You're there with the rest of us, you know? But guess what? On the inside, yeah, we're not fertile. Like, my hormones are amazing right now. Am I fertile? No. Thank God, right? I have grandkids. That would be bad. That would be so bad. We're not fertile, but you know what? I feel amazing like I did when I was fertile, you know? And that's the feeling that I think a lot of women have. It's not just, oh, we're just gonna minimize it. You know, here's the lowest dose for the lowest amount of time. Or do we want to slay the day and we feel amazing, jump out of bed, build muscle? So if you're working out and you're lifting weights and you're like, I don't know why I have no muscle, like what is happening? Those are the small changes that you can actually reverse. What other questions you guys have? Oh.
So if you're high risk and you're feeling okay, you're working out and your nutrition, can you survive all this without anything? Like, can you?
Yeah, I feel like there are people out there that do just fine without any kind of hormones. If their lifestyle, once again, the first thing that I always bring up is lifestyle. And you guys here already have that nailed because you're part of Kaya. But if your lifestyle is nailed and you're building muscle, which I can see on you, you know, so that's the specimen over there, I can see on you. You're signaling in your body a lot of hormonal changes that may not necessarily require it. Now, there might be a different story if they were to do a DEXA on you, but if your DEXA comes back fine, and you're not losing bone and it's not trending in a way that puts you at risk for fracture in the future, then you can be perfectly fine just with lifestyle. The example that I'll give you is, not everybody in this room will get this because some of you are younger, but who here has to use reading glasses? Oh, look at the room. Okay. That sucks, man. Let me tell you, I was in denial for a long time. Okay, so when it comes, so the example is there are some people that go through life and they never need reading glasses. Why? I don't understand. You know, they can read just fine. But there's the rest of us that for some reason, you know, with every birthday, we start losing some sort of vision. And you do all the things. You're just like, why? The light is so bad here, you know, that I'm over here. Then the font is so small. And there's so many things. But as soon as you put those reading glasses on, you're like, I'm fine. That's hormone replacement. You know, that's similar to it. There are some people that just don't need reading glasses, and some people just don't need hormone replacement at all. And then there's a whole group of people that are like, you know what, this is terrible. I mean, if I had to go through life without reading glasses, it's hard. So I just give up and I put them on and I'm like, I can see everything beautifully, just like when I was 30. So I would say that for any high risk person, as long as you're healthy, you're not having fractures, you're not having things that are detrimental to your life, you can absolutely do it through diet, lifestyle, even possibly some supplementation, you know, because supplementation doesn't carry the risks that are elevated for a certain demographic and population that may not be candidates for hormone replacement therapy.
And who do you, to get a DEXA scan, how do you get that ordered?
Your primary.
Yeah, it's usually
Will they do it?
Yes,
Will
yeah, they
get
did
every
it for
other
me
year.
and I
You
asked
gotta
for it.
get it over at the clinic over, you know, but they'll.
I can order DEXA scans.
Okay.
The issue is with anytime that I'm considered an out-of-network provider. Okay, so I don't participate with insurances. I will give you a super bill after you see me, and you can submit it to your insurance for a partial reimbursement for an out-of-network provider. But that's so I can actually order it. The issue is I have to have a diagnosis code in there in order for your insurance to cover it. So that's where, you know, once again, I have to look at your medical history. There has to be a reason in order for insurance. I can order it, but you can also order it through it's a lot easier to order through your primary because insurance, they work better with people that participate. But you know, Miss Renegade over here, I don't participate with insurance because I don't want them to stranglehold me in my ability to prescribe off-label or to do things outside of standard of care. But it is possible.
So do people's FSAs, will they typically help pay for that too?
I have people pay with the health savings accounts or the flexible savings. It's no issue. Even